Meeting at the Bamenda Regional Hospital Conference Hall on Wednesday, February 22, 2023, the staff of the hospital together evaluated the year 2022 in the presence of the Northwest Regional Delegates of Health, who appreciated their efforts and called on the staff to continue the good work so as to maintain the standards of the hospital.
We were happy during the presentation of the performance that the number of consultations had increased compared to the previous years, the number of deliveries, the number of admissions, and this only goes to say that despite this political crisis, the staff of the hospital are doing a lot to ensure that the population of the Northwest region is healthy. There are some areas that still need improvement, like the area of mother and child health. So I actually urge the administration of the hospital to step up strategies to ensure that we are able to curb maternal mortality and perinatal mortality in this health facility.
The Bamenda Regional Hospital in 2022 recorded a lot of successes, even though with some shortcomings.
Consultations have increased, deliveries have increased, surgeries have increased. We've had innovations in laparoscopic surgery. In the terms of infrastructure, in the terms of human resource, I think the hospital now has 30 specialists, and you see, and all the number of doctors are 50. So indeed, there has been a regain of activities for this year, and the challenges have really been still in human resource, because you see that having 519 staff, not so only 156 are state employed. So it's a big challenge. Another challenge has been unpaid bills. We find that we consulted more than 1,200 persons who were treated and then they could not pay their bills. And we've also had a lot of trauma cases because of gunshot cases. It shows that, the hospital has been functioning 24 and 24.
In 2022, 9 maternal deaths were recorded at the hospital. The management of the hospital is determined to reduce this number.
The health system is made in such a way that pregnant women need to go to the health centers, have their ANCs, and all these chief of centers or the district hospitals, they know how to detect danger signs, and then they can refer to the regional hospital to handle early enough. We want the women to start ANC when they just miss their period. Start ANC at the beginning, so in the first trimester, second and third. And so that when the midwife, they see that there's a problem, they refer you early. But most of them just wait, and then they wait when it's time to deliver, they go, and then they discover complications, or they only discover when they're already in labor. You find them arriving at very odd hours. And I want to tell the public that all these 9 maternal deaths we had in 2022, you find that all of them were referred, and some of them could have been avoided if we don't stigmatize cesarean section. I want to tell the population that cesarean section is the safest method of delivery nowadays. Let our spouses, let our community don't see their young wife they've had in their family, and then the doctors say, we think that to save your baby, you should do a cesarean section, and then they start stigmatizing. They start saying, I beg, Muna, just try. Muna, just try. When you try like that, finally you destroy the brain of the child. You have a baby quite all right, but the brain is destroyed. This child will never cross class 1.
During the meeting, some staffs were awarded in recognition of their outstanding performances in the course of the year 2022.
I'm so grateful to the hospital for recognizing me as the best unit head of the theater and the best major of the hospital, for recognizing us for the outstanding qualities they found in us. We are so grateful. On behalf of the other people, I'm so grateful.
The population of Bamenda and beyond have thus been called upon to trust the Bamenda Regional Hospital, hosting more than 50 medical doctors and specialists in order to stay healthy. Other hospitals and health centers around have also been challenged to refer cases to the regional hospital early enough.